Okay, well, welcome everyone. We're going to have a phenomenal presentation about the Affordable Care Act and how it has affected large employers. The Affordable Care Act, or otherwise known as ACA, does not look the same as it did when it was first put into place in 2014. So there have been quite a few changes, and also there are just changes every year that happen because of how it was set up in 2014 to adjust for inflation and so forth. So there's certain things that we're going to go over that pertain to large employers on a general level, and then also how it pertains to clients of Integrities and the medical plans that we offer. So first, let's see here, we're going to get this funny guy here. Just to kind of jumpstart our presentation because we don't want anybody falling asleep. So let's talk about what a large employer is. So a large employer, or what we call an applicable large employer, or an ALE, is an employer that employs on average at least 50 full-time and or full-time equivalent employees on business days during the preceding calendar year. So in other words, you have on average at least 50 full-time employees. So if you are an employer that generally has about 40 employees, and then this year you just jump straight up this month, now you have 50. That doesn't mean that you all of a sudden have to provide health insurance and follow all these rules for large employers. It's based off of, on average, how many employees you had that were full-time or full-time equivalent the prior calendar year. So that's when you start measuring. So you might hit 50 now this year, but it's going to be based off of how many you're employing on average the next year, the next calendar year. And then at that point, then you will find out if you will need to provide health insurance and have to meet the certain requirements in order for you not to be subject to any penalties. An FTE, that's going to be someone that generally, they have variable hours, and so they don't normally work at least 30 hours a week. So what happens is basically, and it's I'm oversimplifying it, but basically you might have two full-time employees that they both work 15 hours on average a week. And if you put them together, then that makes one full-time equivalent employee. That makes one full-time employee. So I'm oversimplifying it, but there is a calculation that we do. And then we also have PRISM that helps us in creating those reports to see if you would constitute as a large employer. So if an employer employs less than 50 full-time and or full-time equivalent employees, even though you're partnered with Integrity, the company is still considered a small employer and it's not subject to penalties. So when the Affordable Care Act came out, it applied different roles to a small employer versus a large employer. And interestingly enough, small employers actually have a bit of a harder time. It's not as affordable for small employers, and that is because of how they're rated. And as a large employer, when you have 50 or more full-time employees or full-time equivalent, you have to provide health insurance, and if you don't, there's a penalty. But the insurance has to provide a certain type of coverage. It has to be considered affordable and so forth. But as a small employer, when you have less than 50 employees, eligible full-time employees, you can decide that you don't want to offer health insurance, and you won't be subject to and you will not be subject to any penalties. Now, part of partnering with Integrity as a PEO for a small employer is a big advantage, because on the open market, employers under 50, they have a hard time. And that is because generally before the Affordable Care Act, there was an 8-to-1 ratio. And what that means is that the disparity in cost between the youngest employee and then the oldest employee in terms of cost was usually 8 to 1. So that was a pretty big difference. And quite a few of us might remember that there was a time when and I would hear employers just straight out say, well, we're going to do everything we can to hire younger employees because older employees have a tendency to cost more. Well, interestingly enough, when the Affordable Care Act came out, they went from an 8 to 1 ratio to a 3 to 1. So that meant that you didn't have this huge gap anymore, but it meant that your older employees actually came down in cost a little bit, but then your younger employees went up in cost. And so it's all of a sudden you don't have a lot of room to spread that premium across. So rates have a tendency to increase. Also, what happened is small employers are what we call community rated. And that means that originally when the Affordable Care Act came out, they said that every employee and every single dependent they had enrolled on the plan, based on their age, had to have their own rate. So that meant that you could have 40 employees, and you're with, we'll pick on Blue Cross Blue Shield, and you're at Blue Cross Blue Shield and you get your monthly invoice and you've got employees that have spouses and children and so forth. That meant that your bill of 40 employees was going to look like a disaster. And that meant that every single employee, based on their age, had a different rate. So you would have a 40-year-old man and a 25-year-old female on the same on the plan, and they were both covering just themselves, but the rate was different based on age. And so it was a mess. And so it wasn't fair to charge more for an employee that was older than it was for younger. So this is one of the changes that happened. Texas petitioned to be able to still do community rated, because that hasn't gone away, but it's applied on the back end. And the front end, it doesn't look like that anymore. So if you're with Blue Cross, United Healthcare, Aetna, Humana Group Plan, and you've got your own policy and you see if you were to ever look at the invoice, you would see it doesn't look like that anymore. There, once in a blue moon, I'll see a plan that still has it like that, and that's because they are what we call a grandfathered plan. So it helps small employers to partner with a PEO like Integrity, because if you went to go get a policy on your own on the open market, you're going to have a 3-to-1 ratio. You're going to be limited to the kinds of plans you can offer and so forth. And what's great about partnering with a PEO like Integrity is that now you're actually part of a large group. You're coming onto a large employer health plan. So you don't get rated like that. And really, like, frankly, probably like 8 times out of 10, I'll even give it 8. We're usually the most competitive when we compare to what small employers already have in place on the open market. And that has to do with the way it's rated. And of course, it also has to do with the risk being distributed amongst hundreds, and eventually thousands of employees. So variable employees. So we have clients that you might be an employer that goes, well, I don't have just employees that work a flat, straight 30 hours a week, because that is the requirement. It used to be 40 hours a week, determined that was a full-time employee. The Affordable Care Act said, well, now that comes down to 30. So this really affected, when the Affordable Care Act came out, this really affected a lot of restaurants and a lot of hotels. And what happened is what ended up happening is, unfortunately, especially those 2 establishments, they cut hours, and they might have had employees that were working with them for a lot of years, but they couldn't afford to all of a sudden pay for health insurance for every single employee. And those kinds of industries usually have a very low low margin for profit. So what happened is the hours were kind of cut back. And then also, those industries in particular already have a different way. They don't have employees that are typically working, unless they're managers, typically working a flat 30 hours a week or so forth. So what we have are variable employees. We have employees that 1 week is probably working 25. 1 week was a great week. Now they were working 37. The next week, that wasn't very busy. School was just starting maybe, and so it's not very busy for that industry. So now they only work 10 hours a week. So you're like, well, gosh, how do I keep track of this? So there's two ways to keep track. The first type, if you have a bunch of variable employees, I don't recommend you do number one, because this means that you would have to look at all of your employees on a monthly basis to determine who has worked full time for that month. And especially if their hours are constantly changing, you would be enrolling and terminating employees like constantly. It would be a constant thing. So I really recommend, and we do this for several of our clients, we do the look back measurement period. And the look back measurement period is three different things. First one is what we call the initial measurement period, and that must last between 3 and 12 months. And what that means is it's a waiting period. So it's a waiting period, and you might have, well, my managers are working at least 30 hours, if not 40 hours a week. So they are going to be eligible. Let's say your waiting period is first of the month following 60 days. But the majority of your employees are variable. So you say, well, I'm going to run a report the first of every month to look back at the past year. And that's usually what I recommend is a year, a 12-month look back. And when I run this report, it's going to tell me that on average, how many hours each employee worked, and now which of my part-time employees are considered full-time equivalents. At that point, then let's say you, out of your 100 employees, you got 7 of them that qualify. Well, then you have an administrative period. So let's say we do the look back from August 1st to July 31st. And so what usually you can have 90 days. So at that point, get those employees enrolled on the plan. You can do 30 days, 60 days. You just cannot exceed 90 days. That means that's the period of time that you have to get those employees that are now shown to be full-time equivalent, to get them enrolled on the plan. And then your stability period, you're not even done at that point. Your stability period is now that they've met the the requirements to be put on the plan. That doesn't mean that, okay, the next month comes and they work less than 30 on average, so now they drop off. No, what that means is that you have to keep them on. It cannot be more than 1 month longer than your initial measurement period. So you have to keep them on for at least whatever the initial measurement period is. So if you're doing a year look back, then we're usually recommending that you keep your stability period the same, that you're keeping them on for at least a year. So they could drop significantly in hours, but they already qualify to be put on there. And so now, even if their hours drop, you still need to keep them on the plan for at least a year. So we have penalties that are associated with a large employer, and it just simply is not enough to provide health insurance. They have to meet certain requirements. So the first one is penalty A, and this is the big penalty. This is the big whammy. So this is if an employer does not provide minimum essential coverage to eligible full-time and full-time equivalent employees, then the annual penalty is calculated as the number of full-time employees, and of course you do your calculation minus the first 30 times 2,000. And actually, that amount of 2,000 is actually, it adjusts for inflation. But to keep it simple, we'll say let's say that you've got 65 employees, and you subtract the first 30 times 2,000. That leaves you with $70,000 as a penalty. So that tells you that if you just were to go without offering any health coverage to your employees, and you are an applicable large employer, then the minimum amount is going to be $70,000 since that 2,000 is adjusted for inflation. Okay. So that's the big whammy there. That's the big determination. And really most plans provide minimum essential coverage. Really, and the minimum essential coverage really is really all the preventive care that is covered at 100%. So the women's exams, pap smears, men's exams, prostate exams, children's immunizations. When you're age 50 and older, then you can have colonoscopies that are covered at 100%. There's a lot of birth control that is covered at 100%. So there are several things that certainly changed with the Affordable Care Act. I think a lot of us might remember when preventive care used to cost a copay. When you went in for your exam, for your wellness exam, it cost a copay. And colonoscopies used to hit the deductible. So colonoscopies, as long as it is a purely preventive measure, is considered preventative and will be covered at 100%. So again, minimum essential coverage, it's very broad, but really what we're talking about is an eligible employer-sponsored plan. And really that's where we fall here on the second item here, any other plan or coverage offered in the small or large group market within a state. So penalty A, let's say you go, okay, well, I've got a plan now and it provides minimum essential coverage. It's covering all these things, all these preventive care services at 100%. I'm done. Well, no, you're not done. You do have another penalty to concern yourself with. It's not a penalty that is it's a penalty that you may never see, but it is a penalty you need to be aware of, because you can get hit with this penalty if the coverage is unaffordable or if it does not provide minimum value. Okay, so there's actually two things in play here. So what happened is when the Affordable Care Act came out, it was actually a requirement. Well, first of all, like I mentioned before, it doesn't look the way it used to look. And affordability was considered 9.5%. As long as the employee was not contributing more than 9.5% of their W-2 income on the lowest cost medical plan, it was affordable. But it was 9.5%, not just of their W-2 income, it was 9.5% of their household income. And that's how it was written. And a lot of people pushed back and said, well, we don't know what their household income is. I mean, how do we know if it's affordable or not? So they changed it, and so it became 9.5% of the employee's W-2 income. So so it's been adjusted for inflation. Currently for 2020, it's 9.78% of their W-2 income. It is going to increase to 9.83% in 2021. So the way that you figure this out is, first of all, if you are a large employer and all you're offering is what we call a MEC, that just provides minimum essential coverage, but you are a large employer, then you need to also offer, and I'm using the word offer for a reason, you need to offer a plan that provides minimum value, okay? And then it also needs to be affordable. So for as long as I can remember, carriers require that the employer pay at least 50% of the employee-only portion on the lowest cost medical plan. And a lot of employers can help themselves with that cost by maybe offering a really low cost plan, maybe even a high deductible health plan. And then if the employees want to buy up to a plan that has copays or that has a lower deductible, then the employees can pay the difference. Or I'll even have employers do a defined contribution method. The employer might say, here, you got $400, you can buy whatever medical plan you want. And they don't even do a percentage, as long as they know that that dollar amount is at least 50% of the employee-only cost on the lowest cost medical plan. So right now it's 9.78%, and some clients will know that I've had this will remember that I've had this conversation with them when I've asked them, well, what is your lowest wage earner making? And the reason I say that is because If on average your employees are making, 40, let's say they're making $20 an hour, then I'm going to say, okay, well, that's also typically your lowest wage earners, $20 an hour. So I'm going to say 20 times 2080. That's how many hours in the year for to figure out what the annual cost is going to be. And so that employee is making 41,600, and we'll use this year it's 9.78% times 9.87%, and then I'm going to divide that by 12, so that's 339.04. So the employee cannot pay more than 339.04 on the lowest cost plan that provides minimum value. And we're going to go over what minimum value means. And reverse discrimination is allowed. So that's kind of interesting because remember, there was a time, when you would pay more as an employer, you would probably contribute more to certain people, and you would contribute more to maybe directors and so forth, or senior management, so forth. Well, let's say you're a law firm, or well, we'll use that example. Let's say you're a law firm, and so everyone's making some pretty good money there, but your receptionist is making $8 an hour. So if you were to use the calculation of 9.78% of, let's say, your lowest wage earning attorney, that would be significant. That would be like, well, you would have to contribute a significant portion. But you could actually use that amount, whatever that is for your attorney, and actually apply it to the receptionist. And not just, and go ahead and you can contribute more for the receptionist than you can for everybody else, just to bring them, just so that you wouldn't have to pay so much out of pocket, because you have more people on your staff that are earning more. So reverse discrimination is allowed, and we definitely help you in figuring out what is the best route, and if that's a possibility, to help you stay compliant, but also not have sticker shock. So minimum value, you're like, well, you keep talking about minimum value. What is this? What does that mean? To oversimplify it, it basically means that the plan is paying at least 60% of all costs. So, and it also includes inpatient hospitalization. Okay. So remember, I mentioned the $2,000 penalty, and that was if you didn't provide health insurance that provides minimum essential coverage. So, but then there's this other penalty, and this other penalty is for if the plan, for one of two things: either it's not affordable, or it doesn't provide minimum value. So let's say you offered a plan, and your employees were paying more than that 9.78% of their W-2 income. And one of those employees goes, well, I just think this is ridiculous. And they go to healthcare.gov and they purchase an individual policy, and then they qualify for financial assistance. One of those questions when they ask for financial assistance is, does your employer provide affordable coverage, and does it provide minimum value? And most employees won't really understand the minimum value, but they'll understand whether or not it's affordable. And let's say the employee gets a subsidy, and it'll take a while, but ultimately at some point you're going to get a notice from the Department of Health and Human Services, and they're going to say you owe a penalty for this one employee because it was not affordable. And you can contest it at that point, which we would help you with that. And I've certainly done that part before. And you just have to show that it's being offered. And again, I go back to the word offer, because I'll have companies, employers that'll be like, well, I can't pay that much money for, what if they all sign up, and I can't pay that much money for health insurance for everyone to meet this affordability requirement. Keep in mind, though, that what is affordable in the way the ACA was written is going to differ than what is affordable to an employee. And as long as the calculation is, as long as it is affordable as it's being offered, that's what matters. You may, out of all your employees, have only 5 people that enroll on this traditional medical plan that provides minimum value, and that's okay. You have to show that you're offering it, and this is why it's very important to be able to provide proof that not only did you offer it, but that if they didn't want it, that they waived it, that they declined it. And I've had to do that before. I've had to provide proof to the Department of Health and Human Services that, okay, yes, this employee did go get financial assistance, but they were offered this and it was affordable and it met the requirement. So it doesn't necessarily mean that they have to take the plan, but they do need to be offered it. And that is how you're going to protect yourself. And really lastly, are these reporting requirements. So, you know, sometimes once in a blue moon, I'll have somebody come out and say, well, I need my 1095 form. I need to go file my taxes. These forms aren't required to file your taxes. When there used to be an individual mandate penalty, and as I'm sure a lot of us are familiar now, that the penalty didn't get removed. It actually we minimized it to 0 because we couldn't remove it. So we minimized it to 0. So employee penalties are gone. Okay, so now an employee could be, well, I don't want health insurance. You know, they might say it's affordable, and it might be affordable from the Affordable Care Act's perspective, but it's not affordable to me, so I don't want it. And they don't take coverage. That's fine. They're not going to be penalized anymore. There's 2 forms as a large employer that do need to be used to report, and this is what Integrity helps with. We will file the 1094-C form. That is the employer form that actually gets filed to the IRS. And then there are the 1095-C forms, and these are the employee statements. These are the statements that go out in the mail. That actually goes out first, and then we have the employer form that we report to the IRS. And we have certain guidelines that we have to meet in terms of time and so forth. So that is right around. The interesting thing with that is that you always have to wait for the prior year to end. So that's why you'll start to hear from us. We'll be reaching out to you, right after that last day of the calendar year. You'll start to hear from us to say, okay, well, this is the time we're going to start your reporting and so forth. So this is part of one of the many services that Integrity offers. But always keep in mind, this is a co-employer relationship that you are in with Integrity. So there are certain things that still drill down to the client level instead of the PEO level. So the ACA compliance at the end of the day is the client's responsibility. Even if you are on the master medical plans through Integrity. However, we are going to do our due diligence, and at the end of every single year, we wait for that last day of the year, December 31st, then we run our reports for all of the prior year to determine if you were an applicable large employer, and if you were, did you provide health insurance? Was it affordable? Did it provide minimum essential coverage? Did it provide minimum value? And in some situations, like I say, we might tell you, hey, we just ran this report, and now you have 52. According to this, for all of 2020, you had 52 employees. You just met the requirement as a large employer. That's fine. It didn't mean that you had to provide health insurance in 2020. It meant that you just met it. So then we're going to help you put a compliant plan in place in 2021. And that's all I have for this presentation. There's certainly more to discuss. It's an ever-changing law. There just simply is not enough time. So always, feel free to give me a call or shoot me an email if you have any questions. I hope you have a wonderful day. Thank you.